Every day, your body produces nearly a liter of mucus, yet most people never notice it. So why does your throat make mucus? Why does it sometimes become thick, sticky, and impossible to clear? And when does normal mucus become a dangerous warning sign? Today, we're traveling inside your throat to watch every stage of mucus, from healthy protection to life-threatening airway obstruction. Let's begin. Why your body makes mucus before we understand disease. We need to understand why mucus exists. Inside your nose, your throat, your windpipe, and your lungs. Millions of specialized goblet cells continuously produce mucus. This slippery layer acts like your body's first line of defense. Every breath you take carries dust, smoke, pollen, viruses, bacteria, and tiny pollutants. Instead of allowing them to reach your lungs, mucus traps them. Tiny microscopic hairs called cilia then move the mucus upward, where you swallow it without even realizing it. Your stomach acid destroys most of the trapped germs. Without mucus, every breath would expose your lungs to injury and infection. Stage 1. Healthy mucus. Healthy mucus is almost invisible. It's thin, clear, smooth, and constantly moving. Goblet cells produce exactly the right amount. The throat stays moist. Speaking remains comfortable. Swallowing is effortless. The cilia sweep away trapped particles like a moving conveyor belt. Most people swallow this mucus hundreds of times every day without ever noticing. This is exactly how your throat is supposed to work. Stage 2. Mild irritation. Now imagine breathing dry air or walking outside during allergy season. Maybe you've just caught the beginning of a cold. Your immune system reacts almost immediately. Blood vessels expand. The throat becomes slightly inflamed. Goblet cells begin producing extra mucus. The mucus is still mostly clear, but now you notice yourself clearing your throat more often. It feels like something is stuck. In reality, nothing is blocking your throat. Your irritated nerves are simply detecting the extra mucus. This stage is usually temporary. With hydration, humidity, or allergy treatment, the throat often returns to normal. Stage 3. Thick mucus. If inflammation continues, everything changes. The mucus becomes thicker, stickier, harder for the cilia to move. This commonly happens during colds, influenza, postnasal drip, dehydration, or acid reflux. Instead of flowing smoothly, the mucus begins collecting along the back of the throat. You cough repeatedly. You constantly swallow. Some people wake every morning feeling like mucus is glued inside their throat. Although uncomfortable, this stage is still usually manageable once the underlying cause is treated. Stage 4. Excessive mucus. Now your immune system shifts into high gear. White blood cells flood the inflamed tissue. Dead bacteria, dead immune cells, and damaged tissue mix with the mucus. Its color may become yellow, green, or cloudy. Contrary to popular belief, green mucus doesn't always mean antibiotics are needed. It often means your immune system is actively fighting an infection. Conditions like chronic sinusitis, smoking, long-term acid reflux, asthma, or bacterial infections can all cause persistent mucus production. The throat feels constantly coated. Swallowing becomes uncomfortable. Your voice may become hoarse. Persistent coughing becomes exhausting. At this point, a medical evaluation is often appropriate, especially if symptoms persist or worsen. Stage 5. Dangerous mucus. Most mucus problems are harmless, but not all. Sometimes mucus signals a medical emergency. Severe pneumonia can fill the airways with infected mucus. COPD flare-ups may produce large amounts of thick mucus that block airflow. A severe allergic reaction can rapidly swell the airway, making it difficult to breathe. And coughing up blood with mucus should never be ignored. Warning signs include difficulty breathing, chest pain, high fever, blue lips or fingertips, confusion, or coughing up significant amounts of blood. If these symptoms appear, seek emergency medical care immediately. Prevention. Fortunately, there are simple ways to keep your mucus healthy. Drink enough water. Keep indoor air comfortably humid. Avoid smoking and secondhand smoke. Treat allergies early. Manage acid reflux if you have it. Wash your hands regularly to reduce infections. Stay physically active, and if mucus lasts more than 3 to 4 weeks or is accompanied by concerning symptoms, see a healthcare professional. Healthy mucus protects you. Unhealthy mucus is often your body's way of asking for help. Finally, mucus isn't something your body accidentally makes. It's one of the most important defenses protecting every breath you take. But when it becomes thick, persistent, or is accompanied by serious symptoms, it may be telling you something much more important. Recognizing those warning signs early could make all the difference. If you enjoyed this anatomy journey, subscribe to Viral Skeleton. I'm Dr. Bones, and I'll see you in the next episode as we explore what happens inside the human body.